Blood sugar, or glucose, is essential for the functioning of the human body. It is the main source of energy for cells, and the body obtains it through the foods we consume, especially carbohydrates. However, when blood glucose levels become uncontrolled and remain elevated for prolonged periods, serious health problems can develop, among which diabetes stands out. The human body regulates blood sugar levels through insulin, a hormone produced by the pancreas. When this mechanism fails, either because the body does not produce enough insulin or because the cells do not respond properly to it, sugar accumulates in the blood. This condition, known as hyperglycemia, is characteristic of diabetes and can have serious consequences if not treated in time. In this video, we will explore 16 alarming signs that your blood sugar level is high, as well as 8 common symptoms of diabetes, to help you identify and address these issues in a timely manner. 16 alarming signs that your blood sugar level is high. 1. Excessive thirst. Intense thirst, medically known as polydipsia, is one of the most common signs of elevated blood sugar levels. This symptom manifests when the body tries to eliminate excess glucose by increasing urine production. During this process, a significant amount of water is lost, leading to dehydration. As the body experiences this loss of fluids, it activates the mechanisms that create a constant and insatiable feeling of thirst. This symptom can be particularly uncomfortable, as no matter how much one drinks, the feeling of thirst persists, reflecting the body's effort to restore water balance. 2. Frequent urination. The frequent need to urinate, medically known as polyuria, is a common symptom in various health conditions. This phenomenon occurs when the body tries to eliminate excess sugar in the blood through urine. When glucose levels are high, the kidneys work harder to filter it, which leads to an increase in urine production. As a result, the bladder fills more quickly, creating the need to empty it more frequently. This process is not only uncomfortable, but it can also lead to dehydration and an electrolyte imbalance if not managed properly. 3. Extreme fatigue. The feeling of constant fatigue is a key symptom that may indicate elevated blood sugar levels. This fatigue occurs because, under normal conditions, the body converts sugar into energy through the action of insulin, a hormone that allows glucose to enter the cells to be used as fuel. However, when there is a lack of insulin or the body develops resistance to it, this process is compromised. As a result, glucose accumulates in the bloodstream instead of entering the cells, depriving them of the energy needed to function properly. This generates a persistent feeling of fatigue and weakness that is not easily relieved by rest or sleep. Extreme fatigue can affect the ability to perform daily activities, decrease concentration, and reduce overall quality of life. 4. Blurred vision. Hyperglycemia, or elevated blood sugar levels, can have a direct impact on eye health, manifesting as blurred vision. This happens because excess glucose in the bloodstream alters the fluid levels in the lens, the eye's natural lens. When the lens swells or changes shape due to this imbalance, the ability to focus is affected, resulting in blurred vision. This symptom can appear intermittently, fluctuating with blood sugar levels, but it is a crucial indicator that the body is having difficulty regulating glucose. If not properly managed, this condition can lead to more serious eye problems, such as diabetic retinopathy, which can compromise long-term vision. 5. Slow wound healing. People with elevated blood sugar levels often experience slower healing of cuts and wounds, a symptom that can have serious implications if not properly addressed. Chronic hyperglycemia can damage blood vessels, affecting both large arteries and small capillaries. This vascular damage reduces blood flow to the injured areas, which in turn limits the amount of oxygen and nutrients that reach the wound, essential elements for tissue repair. Furthermore, the high glucose environment promotes the proliferation of bacteria, increasing the risk of infections that can further complicate the healing process. Therefore, slow healing is not only a sign of blood sugar dysregulation, but also an indication of a compromised circulatory system that can lead to serious complications, especially in people with diabetes. 6. Frequent infections. Elevated blood sugar levels can significantly weaken the immune system, increasing vulnerability to various infections. Hyperglycemia interferes with the ability of immune cells, such as white blood cells, to combat pathogens, which reduces the effectiveness of the body's immune response. As a result, people with hyperglycemia are more likely to experience recurrent infections, especially in areas such as the skin, urinary tract, and gums. These infections can be more difficult to treat and tend to persist or recur due to the combination of a compromised immune system and a bodily environment that favors bacterial and fungal growth. Furthermore, the healing process is delayed, which further exacerbates the situation and increases the risk of serious complications if infections are not managed properly. 7. Excessive hunger. Even when food is consumed regularly, some people with high blood sugar levels may experience a constant and insatiable feeling of hunger, known as polyphagia. This phenomenon occurs because despite the abundance of glucose in the bloodstream, the body cannot use it efficiently due to a lack of insulin or resistance to this hormone. As a result, the body's cells are starving for energy, as glucose cannot enter them to be used as fuel. This energy deficiency triggers signals of persistent hunger, leading the person to eat more in an attempt to meet the body's energy demands. However, due to the underlying metabolic dysfunction, the feeling of hunger is not easily relieved, which can lead to a cycle of overeating without true satisfaction or improvement in energy levels. 8. Unexplained weight loss. Despite a significantly increased appetite, weight loss without an obvious cause can be a sign of hyperglycemia. This symptom manifests because, when the body's cells cannot access energy from glucose due to a lack of insulin or resistance to it, the body is forced to seek other sources of energy. In response, the body begins to break down fat and muscle reserves to obtain the energy it needs, leading to a noticeable and rapid weight loss, even if food intake is maintained or increased. This catabolism process, where the body breaks down its own tissues, not only results in weight loss, but can also lead to muscle weakness and a general reduction in body mass, affecting the person's overall health and well-being. Unexplained weight loss in the presence of hyperglycemia is a concerning sign that requires immediate medical attention, as it indicates a severe metabolic imbalance. 9. Tingling and numbness. Nerve damage or neuropathy is a common and concerning complication of chronic hyperglycemia, especially in individuals with uncontrolled diabetes. This nerve damage often manifests as tingling sensations, numbness, or pain in the extremities, particularly in the hands and feet. Neuropathy develops gradually as high levels of glucose in the blood damage nerve fibers, affecting their ability to transmit signals correctly. In advanced stages, this condition can not only cause discomfort and pain, but also decrease sensitivity in the affected areas, increasing the risk of injuries and ulcers that may go unnoticed due to the loss of sensation. The proper management of blood sugar levels is crucial to prevent or delay the progression of neuropathy and mitigate these debilitating symptoms. 10. Dry mouth. Constant dryness in the mouth, medically known as xerostomia, is a common symptom associated with elevated blood sugar levels. This condition occurs when hyperglycemia leads to a reduction in saliva production, which is crucial for keeping the mouth hydrated and protecting it against bacteria. The lack of saliva not only creates an uncomfortable sensation of dryness and difficulty swallowing or speaking, but it also creates an environment conducive to the development of oral infections, such as oral thrush and dental cavities. Saliva acts as a protective barrier, helping to clean the mouth and neutralize the acids produced by bacteria. Therefore, its decrease weakens these natural defenses, increasing the risk of oral health issues. Additionally, xerostomia can contribute to halitosis, bad breath, and make it difficult to use dental prosthetics, affecting daily quality of life. 11. Dry and itchy skin can be caused by various factors, such as inadequate hydration, the use of harsh chemical products, or even underlying medical conditions. It is important to keep the skin well hydrated and to use specific creams or lotions to relieve itching and restore extremely dry skin, which is accompanied by a constant feeling of itchiness and tightness. This can be a clear indication of possible complications in blood circulation and nerve damage caused by elevated blood glucose levels. In addition to what has been previously mentioned, it is important to highlight that extremely dry and dehydrated skin can trigger the formation of deep and painful cracks, which, unfortunately, are highly susceptible to being colonized by bacteria and other pathogenic microorganisms, potentially leading to complicated and difficult-to-treat skin infections. 12. Vision of bright flashes or dazzling lights. Some people with hyperglycemia may experience intermittent flashes of light or dark spots in their visual field, which can be a symptom of eye complications related to elevated blood glucose levels. It is important for these individuals to consult an ophthalmologist to receive an accurate diagnosis and appropriate treatment. This could be considered a possible indicator of potential injuries to the blood vessels located at the back of the eye, a medical condition known as diabetic retinopathy. 13. Symptoms of frequent headaches and how to relieve them. Many people frequently experience headaches, which can be caused by various reasons such as stress, lack of sleep, dehydration, or even vision problems. Persistent headaches may be linked to fluctuations in blood glucose levels over time. Hyperglycemia, that is, the excessive increase of glucose in the blood, can cause intense headaches as a result of dehydration and the additional stress it generates in the body. 14. Digestive problems can be caused by a variety of factors, such as diet, stress, lack of exercise, and genetics. It is important to pay attention to the symptoms and seek medical help if the problems persist. Elevated blood glucose levels can negatively impact the functioning of the digestive system, which can trigger a series of unpleasant symptoms, such as nausea, vomiting, diarrhea, or constipation. It is important to maintain proper control of blood sugar levels to prevent long-term complications. This is mainly due to the chronic damage that sustained hyperglycemia over time can cause to the delicate nerves that play an important role in controlling the digestive process in the body. 15. Increase in body weight. While some people may experience unexplained weight loss, others may experience a significant increase in weight, especially in the abdominal area. It is important to pay attention to these changes in the body and consult a healthcare professional if necessary. This may be due to the fact that insulin, the hormone responsible for regulating blood sugar levels, also plays an important role in the process of fat storage in the body. 16. Variations in mood. How different factors influence our emotional disposition. Variations in mood, such as irritability or feelings of sadness, may be linked to elevated blood glucose levels. Variations in blood glucose levels can have a significant effect on neurotransmitter activity in the brain, which can significantly influence emotional balance and mental well-being. 8 symptoms of diabetes. Diabetes is a chronic disease that affects the way the body processes blood glucose. There are several types of diabetes, the main ones being type 1, type 2, and gestational diabetes. Each type has its own particularities, but they all share common symptoms. 8 typical symptoms of diabetes are described below. Polyuria, frequent urination. This is one of the most characteristic symptoms of diabetes. As mentioned above, the need to urinate frequently is due to the body's attempt to eliminate excess glucose in the blood through the urine. Polydipsia, excessive thirst. Constant thirst is another classic symptom. As the body loses fluids due to polyuria, an intense thirst is generated that cannot seem to be quenched. Polyphagia, excessive hunger. Despite consuming more food, people with diabetes may feel constantly hungry. This happens because the body cannot use glucose efficiently, which causes the cells to ask for more energy. Unexplained weight loss. In people with type 1 diabetes in particular, Rapid weight loss may be one of the first signs of the disease. This is because the body begins to break down fat and muscle for energy due to the inability to use glucose. Fatigue, lack of energy, and a constant feeling of tiredness are common symptoms of diabetes. The body's inability to use glucose as a source of energy causes this persistent feeling of fatigue. Blurred vision. Blurred vision is an early symptom of both hyperglycemia and diabetes. High blood sugar can affect the eye's ability to focus properly, resulting in blurred vision. Frequent infections. People with diabetes are more prone to recurrent infections, as prolonged hyperglycemia can weaken the immune system. Common infections include those of the skin, urinary tract, and mouth. Slow wound healing. Diabetes affects the body's ability to heal. High blood sugar can damage blood vessels, which reduces blood flow and thus slows wound healing. Complications associated with hyperglycemia and diabetes. If high blood sugar levels are not properly treated, they can lead to serious complications. The most common include cardiovascular disease. Diabetes increases the risk of heart disease and stroke. Hyperglycemia can damage the blood vessels and nerves that control the heart, increasing the likelihood of heart attacks and other cardiovascular complications. Diabetic neuropathy. This condition refers to nerve damage due to prolonged hyperglycemia. Symptoms include pain, tingling, numbness, and weakness in the extremities. In severe cases, it can lead to complications such as foot ulcers and amputations. Diabetic nephropathy. Diabetes is a major cause of kidney failure. Hyperglycemia can damage the blood vessels in the kidneys, preventing them from functioning properly. If left untreated, it can lead to the need for dialysis or a kidney transplant. Diabetic retinopathy. This is an eye complication that can lead to blindness if left untreated. Hyperglycemia can damage the blood vessels in the retina, affecting vision and ultimately leading to vision loss. Diabetic foot. Diabetic foot is a serious complication resulting from nerve damage and poor circulation in the extremities. Foot ulcers can easily become infected and, in severe cases, can lead to amputation. Given these info, it is crucial to recognize the early signs of diabetes. Often, the initial symptoms are so subtle that many people overlook them, which can lead to more severe complications caused by long-term damage. Are you experiencing symptoms of high blood sugar or diabetes? What methods do you use to monitor your blood sugar levels and maintain your health? Share your experiences and strategies in the comment section below. If you found this video informative and helpful, please hit the like button and share it with your friends. Don't forget to subscribe to our channel for more updates and videos like this one. Thanks for watching.